For an individual to demonstrate their competence in first aid, they should hold a certificate upon completing the required first aid training. As per the Health and Safety First Aid Regulations 1981, Emergency First Aid at Work or EFAW and First Aid at Work FAW, they should meet the ends of the majority of businesses and remain the building blocks in the provision of First Aid at Work training. However, employers have the flexibility to choose whatever level of first aid training is appropriate for their business need and circumstances. Now let's ascertain on how we can assess the situation of a causality. If you think someone needs your help, before you act, you need to check if the situation is safe and easy to access. These checks can be broken into two stages. 1. The primary survey. 2. The secondary survey. Let's now look into details of how these surveys are carried out. Primary survey. This is a quick way to determine if someone has any injuries or conditions which are life-threatening. If you follow each of the steps methodically, you can identify each life-threatening condition and deal with it in order of priority. Consider the acronym Dr. ABC. D. Danger. R. Response. A. Airway. B. Breathing. C. Circulation. Now, click on each of the topics to learn more. After understanding each topic, click the Close button. If someone needs help before you attend the victim, you need to ensure that the area is safe for you to approach. For example, if you can see or hear any danger nearby, like broken glasses, live electricity, oncoming traffic, then make the situation safe and then consider approaching. If you cannot ascertain to make the area safe by yourself, call for assistance. Check if the victim gives a response when you say hello or are you all right? You can also ask them, can you please tell me your name? If they don't respond, you can do the following. For adults, pinch their earlobe or gently shake their shoulders. For child, tap their shoulder. For baby, tap their foot. If they are still unresponsive, you can move to the next stage, airway. If the victim responds by making eye contact with you or some gesture, then you know that they're responsive and you can move on to the next stage, airway. Check if the victim's airway is clear. If yes, the victim's airway is clear and open, then move on to the next stage, which is breathing. If no, and the victim is responsive, then treat them for conditions that may be blocking their airway, such as choking. Remember, only move on to the next stage, which is breathing, once their airway is open and clear. And if the victim is unresponsive, tilt their head and lift their chin to open their airway. Consider the acronym. How does one ensure that the victim is breathing? For the same, you need to look, listen, and feel to check their breathing. If no, and the victim is responsive, treat them for whatever is stopping them from breathing. For example, an obstructed airway. Remember, it is only after this that you need to go to the next step, circulation. If no, and the victim is unresponsive, call for expert help like an ambulance, etc. Or try to get someone else to call for help. At this stage, you need to start giving chest compressions and rescue breathing, which is called CPR, cardiopulmonary resuscitation. We will study in detail about CPR in the coming section. If CPR has started in this stage, then you probably won't be going on to the next stage, which is circulation. Consider the acronym Dr. ABC. Check for signs of any severe bleeding. If you find any signs of bleeding, control the bleeding with your gloved fingers, dressing, or clothing. You need to call for ambulance at this stage or use someone's help to do the same. At the same time, treat them to reduce the chance of going into shock. If you don't find any bleeding and you haven't found any life-threatening conditions, then you can move on to the secondary survey to check for any other illness or injuries. Consider the acronym. If someone needs help before you attend the victim, check if the victim gives. Consider the. Now let's look on to some revision questions. Please select the correct answer. What is the best method to check the response of a baby? In this survey, you can start asking the victim about what happened? How did it happen? You can also check with him or anyone near to him for any kind of illness or injuries. You can also note all these points to hand it over to the emergency services. Try to find out the below 3 items: history, symptoms, signs. You can ask the victim to describe exactly what happened, leading up to them feeling unwell or injuring themselves. You can ask other people near the scene too, and also look for clues. For example, if they've had a car accident, the impact on the car will help you work out what type of injury they could have. Ask the victim about any allergies they may have. Are they into any kind of medication? Did they already have any pre-existing condition? When did they last eat any food? What happened in actuality? Ask them to give you as many details as possible. Here are some of the key questions that need to be asked to the victim. You have to listen carefully and, if required, make a note. Can they feel any pain? Can they describe the pain? What makes the pain better or worse? When did the pain start? Check the casualty over from head to toe using all your senses. Look, listen, feel, smell. Remember, you may have to loosen, open, cut away or remove clothing. Ask their permission to do this and make sure you are sensitive and discreet. Now let's look into the head-to-toe examination techniques. Breathing and pulse. How fast and strong is their breathing and pulse? Bleeding. Check the body from top to toe for any bleeding. Head and neck. Is there any bleeding, fracture? Ear. Do they respond when you talk to them? Eyes. Are they open? What size are their pupils? If they are of different sizes, this could mean a head injury. Nose. Is there any blood or clear fluid coming from the nostrils? This could mean a serious head injury. Mouth. Check their mouth for anything which could block their airway. Look for mouth injuries or burns in their mouth and anything unusual in the line of their teeth. Neck. Loosen any clothing around their neck to look for signs like a medical warning medallion or a hole in their windpipe. Run your fingers down their spine without moving it to check for any swelling, sensitivity, or deformity. Skin. Note the color and temperature of their skin. Pale, cold, clammy skin suggests shock. A flushed hot face suggests fever or heat stroke. A blue tinge suggests lack of oxygen from an obstructed airway, poor circulation, or asthma. Chest. Check if the chest rises easily and evenly on each side as they breathe. Feel the rib cage to check for any deformity or sensitivity. Note if breathing is difficult for them or painful in any way. Collarbone, arms and fingers. Feel all the way along the collarbones to the fingers for any swelling, sensitivity or deformity. Check they can move their elbows, wrists and fingers. Arms and fingers. Check that they don't have any unusual feeling in their arms or fingers. If their fingertips are pale or grayish blue, this could suggest their blood isn't circulating properly. Also, look for any needle marks on the forearms, which suggest drug use. Spine. If they've lost any movement or sensation in their legs or arms, don't move them to check their spine, as they may have a spinal injury. Otherwise, gently put your hand under their back and check for any swelling or soreness. Legs. Check the legs for any bleeding, swelling, deformity or soreness. Ask them to raise one leg and then the other, and to move their ankles and knees. Toes. Check their movement and feeling in their toes. Compare both feet and note the color of the skin. Grayish-blue skin could suggest a problem with their circulation or an injury due to cold like hypothermia. Now, let's look into some recap. Please select the... To check the victim's medical history, we can use the acronym AMPOL. Please select the correct definition from below. Now, let's learn when the ideal time to call an ambulance is and the important points to be kept in mind while calling. Before a call has been made to an ambulance, you need to assess the causality first. As we have seen above, by following the steps of primary survey, we can decide whether there is any life-threatening or any other serious conditions. If the area is also not safe to access the causality, then call the ambulance straight away. If someone's condition isn't serious, then you need to decide if they need treatment or not, and what options are there. For example, to drive them to the hospital or to call their doctor's surgery for medical advice. Once your line is through to the emergency center, please give your name, a description of the location that you are calling from, a description of the victim, a phone number to call you back, a description of the incident and how serious it is, details of any hazards such as any gas leak, fire, any live electricity, etc. Remember, you have to be calm and precise. In this session, we would study